Hello everyone, in this short video I'll be talking about liver cirrhosis, stage 1, 2, 3, signs and symptoms, what to expect, and people that may be living with the liver cirrhosis and they don't know about it. So that will be the topic that I'll be covering today. Let's get on to it. Hello everyone. For those of you that don't know me, my name is Edgar Lozano, and today's video is going to be regarding the cirrhosis of the liver. Cirrhosis is advanced scarring of the liver. I'm reading my notes because I cannot remember all these things by heart, even though I know what are the symptoms and functions of the liver. Sometimes you tend to forget, and in a video, of course, we want to give you accurate information regarding to this condition that is a very serious condition, but many people are not aware. Even though they have it inside their body, they're unaware because it's like a silent disease. You find out sometimes when it's already very advanced, and many times it's irreversible. So it's very important that people are informed, are educated in regards to the liver cirrhosis that worldwide affects thousands and thousands of people. So cirrhosis is advanced scarring of the liver where healthy tissue replaced by scar tissue, impairing the vital function like filtering blood and storing energy in your body, often resulting from long-term damage due to alcohol abuse, hepatitis B or C, fatty liver, also other conditions. While the scarring itself is often irreversible, treating the underlying cause can slow down the progression of the cirrhosis, and management focuses on lifestyle changes like stopping alcohol, medication that sometimes causes the liver, focusing on lifestyle changes and stopping alcohol, medications, and sometimes liver transplant for severe cases, like in my case. And I'll be talking about that later in the video. With symptoms ranging from fatigue, jaundice, and fluid buildup in your body. Those are very important things that I will speak about it in this video. So liver has many functions. The liver performs over 500 vital functions, primarily filtering blood to remove toxins, metabolizing nutrients, fats, proteins, carbs, producing essential substances like bile for digestion and blood clotting factors, storing vitamins and minerals, and supporting the immune system. That is one of the primary things that when we get exposed to an infection, the liver helps the immune system fight infection, viruses, and removing bacteria from our body, making it crucial for overall metabolism and detoxification of our system. That's why it's so important, the liver in our body. Those are the main functions of the liver, even though it has many, many functions. It's hard to memorize or to know all the functions. So again, life expectancy with cirrhosis varies greatly from over decades in early stages, compensated cirrhosis to months to a few years in advanced stages. In my case, I was diagnosed in 2009, and I lived with the disease for 16 years. And I will mention that more in the video later on. Depending on the severity, stages 1 through 4, overall health, treatment and complications like liver cancer or failure, early diagnosis and management can slow progression, but once cirrhosis sets in, it's generally irreversible. Focusing treatment or slowing damage and extending life. It's very important to mention that if you know someone or if you suffer from cirrhosis, you should be compliant with your treatment, what your doctor, your hepatologist tell you to do, what not to do. It's very imperative that you follow the regimen of treatment. If they tell you you cannot drink, you should not be drinking, you should not be smoking, you should stop eating certain foods to help slow down the damaging and keep your life extended period before you will need a liver transplant, because the only thing that really can save you from dying from cirrhosis is a liver transplant. Once you get a liver transplant, then your life changes dramatically, very, very, very much. It's unbelievable, the change from before the transplant and after the transplant. I will talk also later about that. For many people, they ask themselves or have somebody, a family member, they say, can cirrhosis of the liver be cured? The answer is no. Liver cirrhosis, scarring of the liver, isn't incurable. As the damage is often permanent, but it can often be managed slow. The only thing that can save a person from ultimately dying from liver cirrhosis is a liver transplant. Some people can last many years with the liver cirrhosis if you manage your life, if you adhere to a treatment that the doctor will tell you to do. You can live years, like in my case, 16 years. Some other people they're not so lucky, and they suffer severe signs and symptoms, and many times die from cirrhosis because they don't have the means, they don't have the medical help that they need, and for many reasons, people die. So no, liver cirrhosis cannot be cured. So liver cirrhosis has 4 stages, stage 1 through 4. What is stage 4 cirrhosis of the liver? Stage 4 cirrhosis is also called decompensated or end-stage liver disease, the most severe form where the liver is failing, leading to severe symptoms like abdominal swelling, ascites, leg swelling, edema, which I had. It's not fun. It's really uncomfortable, painful. Also jaundice, your skin becomes yellowish. You can see sometimes people with the yellowish face, body, mostly the face, and their eyes become very yellowish. And many times when people die from cirrhosis of the liver, when they die, they become yellow because of the jaundice. It's very, has to do with the bilirubin level in your body. And also, yeah, like I said, yellow skin, eyes, confusion. So it's called hepatic encephalopathy. And internal bleeding from swollen veins, varices in your esophagus, which I had. In 2009, I vomited a small bucket of blood, and that's when I was diagnosed with cirrhosis of the liver back in 2009. Now we are on 2025. So imagine the amount of years that I went through living with that I already was diagnosed, because I was already suffering from severe signs and symptoms that were very life-threatening, like bleeding in the esophagus from the varices that burst because of what causes that is that the liver is already, the tissue is already scarred, so the blood circulation doesn't go through because the blood pressure is stopped by the scarring of the liver tissue. So the blood finds other little small vessels, so it builds up pressure, and that's why they call it portal hypertension, because the portal vein leading to your liver becomes occluded with the scar tissue, and also many times with the blood clot that forms there from the pressure that builds, so the blood stays there without circulating and forms blood clots, and that causes the blood pressure to go different ways. And it's very common that people like us, like me, that we suffering from this disease will have like viruses, the same ones that you have in your legs. It will be the same in your esophagus or in your intestines. And when the pressure is so high, they burst. And that's when you start getting blood into your stomach. And of course, those will trigger nausea. And when you get so nauseous, that's when you will throw up and throw up blood. And if they don't do any emergency procedures in your esophagus, you can die very quickly. I know people personally that they die from this bleeding in the esophagus from cirrhosis of the liver. It's sad to say, but it is true. And when you have bleeding like that, they will go with they call it upper endoscopy, with like it's like a hose with the camera and equipment that they can do something called banding to it's like a rubber band, so to speak, that they do in the area that you are bleeding, and they tend to like block, like kind of like stitching, so to speak. I don't know how to explain it, but it's kind of like that, and that will stop the bleeding. And eventually you probably have to do it many times, like in myself, they did every 6 months, they had to do banding, and they normally put you to sleep for this procedure. And you don't really feel anything because you are sedated, general sedation. But when you wake up, you also don't feel pain. The pain, you will feel it when you eat or drink, when you swallow. That's when you will feel the pain. And it's like somebody staring you from the inside because of the procedure they did. So you have to eat very slowly, a small bite. Be sure you chew your food really, really good, so it will swallow and it will go very smooth. If you forget to chew your food really good, you will really feel it. You will have very enormous pain in your chest, like it's ripping you inside. So that's one of the things that happens with, they call it banding of the varices in the esophagus. Let's see. Treatment is challenging with the liver transplant, often the only cure. So like as I mentioned earlier, the only way that people can survive a liver cirrhosis is with a liver transplant. There's always a risk when you get a liver transplant. Anything can go wrong. So people that is going to go through a liver transplant, you have to be conscious, and you have to know that there's always, in any procedure, there's always a small chance of risk. Not very many people have it, but there is some people that have complications with the liver transplant. But most cases, they are successful. If you were to have a liver transplant failure, more likely, they probably give you another liver when it becomes available. Once you get a liver transplant, you have to adhere to the treatment, to the whatever the doctor, the hepatologist, the surgeon, they tell you to do. You should do it. Follow step by step, religiously, because it's a major surgery, and it can be painful. It can be complications, but once you start healing, once you start feeling better, it is worth it. I am living proof of a liver transplant, a successful liver transplant, and I am making this video to share with the public, with the people out there, with you that are watching my video. Maybe you have a relative, maybe you know somebody, you know a friend that have this problem, and sometimes people are unaware of like the resources, the help that is out there available for them. You have to reach, you have to speak, you have to speak up. Don't keep it to yourself. Don't be embarrassed to tell the people that you have a liver cirrhosis. Don't be embarrassed to tell the doctor. No matter how you get it, from alcohol, hepatitis B or C, it doesn't matter. You should not be embarrassed of telling your doctor what happened to you in your life, because they are the ones that they can help you. They are the ones that will initially start the treatment and possibly help you get a liver transplant down the road in the future. As long as they see that you are compliant with what they tell you, and you are honest, truthful with the doctor, with the team, because there is a team, it's a liver transplant team. So you have to be honest with them. And if they tell you you cannot drink, you cannot smoke, you should not do it, because that depends on your liver transplant. If they see that you are compliant, that you are telling the truth, and they do a drug test on you, on your blood, alcohol, to see if you are really compliant, then they'll see, well, this person is responsible, is compliant, this person deserves to get a new liver. But if there's many cases that I know also that the person has liver cirrhosis and they have ascites and they're really suffering already, and they're not compliant, they still drinking, they still smoking, and that if the doctor, the team sees that, then they're not going to waste a new liver on a person that is not going to comply with the treatment. They rather give it to somebody that really is compliant, that really is serious about their health, about extending their life, that they care about it. So very important to remember these things. Be compliant if you need a liver transplant. Very important. That's my advice. What are the early signs and symptoms of cirrhosis? Often has no symptoms. It is true. Very often there's no symptoms. But they do appear. They are subtle and included fatigue, weakness, loss of appetite, unexplained weight loss, nausea, mild abdominal discomfort, upper right side, and the upper right side, and itchy skin. That was one of my major symptoms that appear on me. But later on the late stage, there was an itchiness that you get on your skin that I used to scratch myself, my legs, so bad that I would start bleeding, because the itchiness is something that you scratch in the arm, and then down here start itching, and then it spreads all over your body. Once you start scratching, the itchiness, like if it bursts everywhere in your body. Very, very, I don't wish that to anyone, to go through this kind of symptom, itchiness, because it's very bad, very terrible. Sometimes you just want to rip your skin apart. Honestly, that's how I felt sometimes, because the itchiness was so severe that I couldn't stand it. Sometimes the only thing that would like relieve my itchiness was getting the hot shower, and the hot shower will like relieve the itchiness. But sometimes you cannot get in the hot shower right away, or like you're on the street or you are somewhere, and you cannot be in a hot shower all the time. So it is terrible, you know. Also, people that has been drinking and drink heavily, when I was a teenager, I did this when I was a teenager because I gather or hang around with a group of friends that we all drank heavily and straight alcohol. And I'm not proud to say that, but sometimes when you're young, you make decisions that you don't know, that we are so ignorant about the things that can happen to us later on in our lives, and lack of knowledge of. So in my case, I used to live by myself and had no parenting supervision. Is because I chose that life, because I moved at a very young age independently from my family. I live by myself. I work. I went to school by myself. So also with that came the freedom that I had, that I could go anywhere, anytime by myself with my friends, to clubs, to bars, things like that at early age. So not proud of that, but that kind of life is the one that led me to have liver cirrhosis later on in my life. And actually, in my early 20s, I already had the liver problem. I remember going to a doctor checkup, and they did a lab test, and the doctor told me, you have liver problem, you have to watch your liver, there's something wrong with your liver. But this doctor never said anything else. And young and lack of knowledge, education, didn't do anything. And yeah, I continued drinking. However, I stopped from this date. I stopped drinking like 25 years ago. One day that I got really sick, I got drunk, and I got sick for like 2 days. Everything was green. I could see everything was green. And vomiting, drinking water, and whatever I drank, it was vomiting. It was sad. It was really bad. After that day, I said, I'm not going to drink anymore. Sometimes, here and there, I would drink a beer, like socially drinking, but not like to the point of getting drunk. And that's when I decided to like stop drinking. And after my diagnosis, the doctor said, you should not drink alcohol anymore. So that's when I really never had any more drop of alcohol ever since, you know. So I also had these 16 years without so many complications, because I tried to adhere to the doctor's recommendations for my life. So they said cirrhosis from drinking typically develops after 10 or more years of drinking heavy alcohol. So be careful. If you're a heavy drinker, be careful. And if you want to know how to check your liver function, just go to your doctor. Say, I want to find out like what my liver function is. They do a test on your liver, a blood test, and they can find out like how your liver, how your kidneys are, and it can be helpful to know what your situation is. Or if you have fatty liver, they can help you. So do your diligence, check with your doctor, see how you are doing. You suspect that you may have something wrong with your liver, or that you don't feel good. It's always good to check with your doctor, and don't be afraid, don't be embarrassed to speak up to your doctor, even to your family, because it can be helpful. And I had to mention that the number one cause of liver cirrhosis in the US and in the world, I would say the use of heavy alcohol drinking and or hepatitis B. Those are the most common causes of liver cirrhosis. So for you to be aware of those things. Hepatitis C viruses also can cause liver cirrhosis. So please be aware of those. What food should you be avoiding with cirrhosis? So for liver cirrhosis, avoid alcohol, high sodium foods, processed meats, canned foods, salty snacks, sugary drinks, refined carbs, and unhealthy fats. Those are the things that kind of food that you should avoid if you know that you have liver cirrhosis. It's very important. Sugars and carbohydrates, you should reduce and talk to your dietitian if you have one, or to your doctor regarding your diet. When you have liver cirrhosis, the color of your urine is, if you have a liver problem, it tends to be, it turns dark, like color, like a color, or like a tea color, dark tea color, due to the excess bilirubin. A yellow pigment in the liver can process properly. So this causes this, and also what I mentioned earlier, the bilirubin causes yellowish in your body, jaundice. You become yellowish, your eyes become yellow, the white part of your eyes become yellowish. Those are very common with the liver disease. So what are the red flags of cirrhosis? Symptoms of cirrhosis: feeling tired, unwell all the time, loss of appetite, losing weight without you really doing diet. That's one of the signs. Feeling or being sick all the time, and belly pain, stomach pain. Those are signs that maybe there's a problem with the liver. Symptoms that you should be aware and have a check out. If you are having symptoms like this, please have a check out with your doctor. Like I mentioned earlier, when I was in my 20s, I went to a doctor, and doctor did a blood test, said be careful with your liver because there is something wrong with your liver. And I mentioned that I was very ignorant about this kind of disease, and I didn't do anything about it back then in my early 20s. And so a person can remain asymptomatic for years. Asymptomatic means that you don't have any symptoms, for those people that don't know the term asymptomatic. It can be, expectancy is around 9 to 12 years without having symptoms. That's a long time, and that gives a lot of time for the liver to get damaged, to have a unhealthy stage. And many times that what I say when we find out is because sometimes we vomit blood, it's already advanced, it's possibly stage 4, and there's no reversal, no reversible time already. There's no time to reverse the disease. Once it's so advanced, the only cure will be liver transplant, as I mentioned earlier. So liver pain typically feels like a dull throbbing ache or pressure in the upper right abdomen under the ribs, under the rib cage, which can sometimes feel sharp or refer to high shoulder, back, or neck pain, accompanied by fatigue, weakness, nausea, and may worsen with alcohol or certain medications. Signaling issues like inflammation or swelling that stretch the liver surface. Those are signs and symptoms that I had because I didn't know at first, and then after my diagnosis, I already knew, but at that point I couldn't do anything. The only thing I could do is follow the doctor's instruction, eat the food that they told me. There was nothing else that I really could do after that. So please be aware, if you have something like that, you have a check with your doctor. Very important. I emphasize, see your doctor, because they can do tests that can find out, and it can really help you down the road. Because once you start having signs and symptoms that are severe, like I did, I mentioned earlier that itchiness of the skin, nausea. One of the main symptoms that I that I experienced was cramping on my body, in my hands, in my arms, in my legs, in my thighs, in my neck. Sometimes when I was yawning, I would get cramps here in the jaw area because what happened, we start losing the muscle. The muscle start disappearing because the tissue is dying because of the function of the liver is it's not there anymore. So basically your body starts slowly dying. When you scratch, when you itch, your skin is very dry. When you scratch, it looks like powder, like white powder. For those people that has been through this, you know what I'm talking about. For people that don't know, those are the signs that people will experience in advance. Cramping that is so painful that it's very hard, difficult to experience, and there's no way to explain how to explain. It's like your hands cramp like this that you cannot open it. If you try to open it, it hurts so much it affects the whole forearm, and then your legs, your thighs, your calf, on your shin area. You're sleeping in the middle of the night, 2, 3 in the morning, and you get cramps that make you like paralyze you. Basically, you become paralyzed by these cramps. They're so strong, they're so severe that you paralyze. It was difficult to get out of bed at nighttime when you're sleeping, and all of a sudden you're sleeping, and then you get a cramp that wakes you up. And it's like if you move, you're gonna feel it harder. So sometimes you have to really, for me, for my personal experience, I had to suffer more pain in order to get out of bed and relieve the cramp, because it doesn't go away just like that. It takes like 5 minutes for the cramp to go away. It's so severe. You try to walk, try to warm up your body. My feeling that the one that caused the body to cramp is the lack of muscle, because muscles are dying, getting smaller. Muscle atrophy is the term, and also the blood becomes thinner and it's more watery, and for that reason your body tends to get cold faster, and when you get cold you get cramps. And it happened to me like at the end, before my liver transplant, my blood looked like, I always say it looked like Kool-Aid, the drink. No advertising anything, it's no sponsor, but it's really true. The blood was so thin, it was just like coloring, like pinkish color, not red. I'm not embarrassed to say these things because I live that and I live in proof. And thank God I got my liver transplant. And I'm healthy now. I'm back to work. So it's a blessing, and I'm very thankful to my donor. I recently found out that my donor was a 33-year-old man, and I'm very grateful, so thankful that I had no words to say to thank this family, this person that decided to donate his organs, and I was one of the recipients. I'm very grateful, and thanks to the mother that tried to contact me. Very, very appreciative, and I have no words to say to the gratitude that I can say or give to this family, to this donor. Thank you so much. So There are 4 warning signs of a dying liver, and the 4 key warning signs of the liver failure often involve jaundice, the yellowish, as I mentioned earlier, the skin and the eyes. Ascites, swelling of your belly, is like a person looks like he's pregnant, and is very, very swollen in the abdominal area. Fluid retention, confusion, hepatic encephalopathy, and easy bruising, bleeding, or dark urine, pale stool. Very common signs that you see this in the late stage of your liver cirrhosis, stage 4. When you start having all these things, you are very close to have a liver transplant, or if you don't have the opportunity, the chance to get a liver transplant, more likely, it's sad to say, but if you don't get the medical help that you need at the right time, many people die from this. And it's very sad to say, and that's why I'm so lucky and I'm so blessed to say, as I mentioned early, I'm very grateful that a donor came along and I qualified for the liver transplant. I put my name on the liver transplant waiting list, and everything is like a plan that God had for me with this liver transplant. I don't want to make this video too long. I probably have to make a second video. There's so many things to talk about the liver cirrhosis that you can make many videos about this, and I don't want to make it too long. However, I will definitely make another video about my liver transplant, how the process, what I had to do before, how to qualify for the liver transplant waiting list, and how to what to do and how life after the liver transplant changes your life. I want to thank you everybody for watching my video. Please don't forget to like, comment, and subscribe to my channel.